Hello, everyone. Thank you for joining us today. My name is Julia Oellerich. I am the Foundation Director here at Upland Hills Health. Before we get started, I do want to go through just a few housekeeping items for you guys. We are going to be answering questions throughout the webinar. So if you have any questions, feel free to hit the chat box down at the bottom. If you are here joining us via computer today, that chat box is usually on the bottom of your screen. And if you're joining us via cell phone, that chat box is at the top. If you are joining us after we've aired, we are going to be answering questions after the webinar. So go ahead and ask any questions that you have for Dr. Fox or Maria. You can send those to info@uplandhillshealth.org. So joining us today, we have Maria Leary and Dr. Sarah Fox. Maria is a registered nurse at Upland Hills Health. She's been working at Upland Hills Health for 38 years, you guys, the past 20 of which she has been in the Infection Prevention Employee Health Coordinator role. Dr. Fox attended college, medical school, and family medicine residency at UW-Madison. She joined the Middlepoint Medical Center as a board-certified family physician in 2009 and joined the UHH team in 2018, practicing in Middlepoint and Dodgeville. She serves as the VP of Medical Services for Primary Care for Upland Hills Health, and she's been a physician leader in our COVID response team since March. So that's definitely been a big effort. Dr. Fox, thank you for that. Maria and Dr. Fox, thank you both for joining us today. We're happy to have you.
Thanks for the invite.
Yeah, absolutely. All right, so UVC light disinfection, that's our topic today. So we're going to just jump right in. Maria, can you share with us what UVC light is and how it works?
Sure. UVC light is part of the ultraviolet light spectrum that is used and effective in killing organisms or inactivating organisms. So it's often used to disinfect either surfaces, environmental things like water and air. It's commonly used, for instance, at the hospital right now, we do have UV light in use in our water system and stuff. And oftentimes it's also used on, let's say, waiting rooms where you direct the light away from people, but then it can disinfect organisms in the air, for instance, in that area.
Okay, so what are the benefits of UVC?
Well, the benefits is that it's, safe to use if it's used correctly. Obviously, there's some things that we have to all be aware of how to use it correctly, and it's set up and designed in a way that can be done safely. It's not a chemical itself, that it's not adding chemicals to something to kill organisms and stuff. And it's effective, I think, is the big thing in, deactivating organisms and killing organisms. And especially in a healthcare setting, when we talk about infections and concerns for people getting infections and maybe transfer of infections from one person to another or from one patient to another, it's been shown to be very effective in adding and enhancing those things that we already do for cleaning and disinfection of our environmental services, and adding that extra bit of safety in disinfection to those services and areas.
In place of our current cleaning procedures, it's just enhancing what we're doing.
Right, you still have to clean. I think that's a basic rule whenever we talk about disinfection. Things have to be cleaned first. You have to remove any bioburden, as we talk about, soil, filth, whatever, first, so that the disinfectant, whether it's a chemical or UV light, can work effectively.
Okay, so you've mentioned a couple times that it's effective in killing viruses. Can you tell us what viruses or bacteria it has been proven to be effective with?
Sure. I mean, things like common organisms that we talk about in healthcare, Clostridium difficile or C. diff, MRSA-resistant Staph aureus, seasonal influenza. I mean, generally in most of the organisms that we talk about, it has the ability to kill. And again, it's based off that wavelength and that spectrum of light and time, for inactivation.
Okay, wonderful. So with this specific emitter system, or the system that we're going to be getting, I've heard a little bit about like shadows causing an issue for light disinfection. Is that going to be, are we going to have to deal with shadows with our system at all?
Well, one of the nice things that we're using with looking at the system we're purchasing, the surface side system, is that it is a 3 emitter system, so that we can use that as a way to eliminate a lot of the shadows that might be in a room when you're looking at sending a wavelength of light out to a surface to kill and disinfect. So if that can't reach that surface, it can't disinfect. So obviously you can't bend around corners and things. And that's where additional systems can add, lights within the room can make sure that you're not missing areas and that you're eliminating those shadows or those areas So you can hit one side with one light and the other side of the surface with another light system. Or for instance, you can have lights out in the patient care part of the room and another light system in the bathroom. And I think we had some pictures. I don't know if we have those available today to share.
I think Jody Cecil, Jody, if you wouldn't mind pulling those up and sharing your screen with the audience so that they can see what the system looks like, I think that would be great. Always having a visual is definitely a better way to represent it. Quick question for you, Dr. Fox, given that you've worked so much with COVID and you've been on our COVID response team, I think I'll ask the question that maybe a lot of people are wondering about. Will this UV disinfection system kill the virus that causes COVID-19?
Well, because COVID is such a new disease and the virus that causes it, the SARS-CoV-2 virus, is such a new thing, there haven't been extensive studies to prove for sure that this is something that we know without a doubt would kill that specific virus. However, it has been shown to be effective against other coronaviruses and other coronaviruses that have caused similar illnesses to COVID, for example, SARS and MERS. And so we do expect that as we get more data about this, that it will be shown to be effective against SARS-CoV-2 or the virus that causes COVID.
Okay. All right, so it looks like Jody's pulled up a video for us here. There's no sound to it, so we can go ahead and keep talking, but this does kind of provide a nice little image of what the system looks like, that the three-piece emitter system like we were talking about, like Maria was sharing, is shown here. So you can see that it really does a good job of hitting all those spaces like Maria was saying. When that video first popped up, I think I saw some laser lights. Is there like a laser mapping system, Dr. Fox? Are you aware of anything like that?
Yes, so there's a system that actually maps the room in a 3D image so that the system actually can design a program to disinfect the entire room. And it minimizes the time that staff has to go in to reposition the machine, and it also cuts down on the total time needed to disinfect a specific space, because it's already figured out ahead of time what positioning would be needed for each of the lights.
Oh yeah, I think that's really important too, the making sure that the lamps are set up in the right place to make sure that they're being as effective as possible. That's a really nice feature that piece of equipment has. Do they have to be used together, the three pieces, or could they be separated?
No, they could be separate units. Yep. So if they're used together, you could see when they're kind of overlapping in some of those images that you saw, that's how we cut down on some of that shadowing. But if you had a very simple space, a relatively small space that you had to disinfect, you could also use a single unit for that space.
Okay. Now we've all heard about UV lights, right? And we all know kind of the dangers of UV light. So bringing in a UV system that emits UV light, Maria, can you share with us, is that going to be harmful to our staff members or our patients?
Well, UV light can cause some skin irritation. It could cause some eye irritation. However, the system is designed that it won't start until we leave the room. It is, on a timing system. And then also, if someone were to enter the room, it would shut off. It would note the presence of someone and shut off immediately to mitigate some of those risks. And stuff. And of course, training of our staff to safely use it and stuff, and signage that would be posted that the system in use are all the things that we're going to do to make sure we can use it safely and effectively.
Okay, wonderful. So which areas of our hospital, do we have a plan for where we're going to be utilizing the UVC system?
We sure do. We've been talking about this a lot. Common areas would be patient discharge, after patient discharge, patient rooms, especially those patients that are on isolation. And in general, depending on how this goes and works, every discharge room if possible. Certainly we can use it in our OR suites, and because it's a mobile system, it can be moved around, and we can work with the companies to map pretty much any space should we need to use it to disinfect.
Okay, that's good. It's mobile, that we can move it around. It's not just a stationary piece of equipment. That's wonderful. So Dr. Fox, can you tell us what you're anticipating as far as the influenza season this year and how that may impact, how COVID may impact that?
Yeah, it's a little hard to predict this year because things have been so different in terms of how much people are traveling and how much spread there has been of influenza across the globe. So it's a little hard to predict this year. We are hopeful that when people are doing all the things that we know will help to prevent the spread of coronavirus, that they are also decreasing the possible spread of influenza. So washing hands, wearing face masks, keeping distance, not going in crowds, all of those things decrease the risk of spread of influenza. The other very important thing that people can do to try to reduce that spread is to get their influenza vaccine. The vaccine is available in clinics and pharmacies now, and if now is a good time to get it. Sometimes we like to wait a little bit later in the year, but now is a good time to get that and make sure that you have your protection for the year.
Okay, so we have them in our clinics now. So if somebody wanted to get their influenza shot, they would just call their primary care clinic?
Correct, and make an appointment for that vaccine. And those who are 65 and older get a special vaccine that has a better immune response for those who are a little bit older. And so that's that special 65 and older shot. It's a high dose flu shot. And then everybody else 6 months to 65 years of age should just get a regular flu shot. And so that can be arranged for through their regular primary care clinic. And again, at some pharmacies that have that flu shot available.
Okay, wonderful. Thank you for sharing that information. So with this equipment, we know that it does disinfect, decontaminate some strains of the influenza virus and potentially the COVID virus. So would there be a long-term need for Uplands to have this piece of equipment, or is this just more of an emergency need now with the influenza season in COVID?
You go ahead, Maria.
Okay, well, no, I think the overall thing was the thought is this is really more of a long-term use of piece of equipment. As we talked about, really the ideal and prime use of the equipment will be for disinfection of rooms for any standard type of isolation that a patient might be on, or, you know, disinfection of our surgical suites, things like that. So it's nice that it can be used in adjunct for other things, maybe with COVID. And certainly as we learn more about COVID, you know, if we have the system here, we'll be able to use it effectively for that as well. But overall, I think it's just looked at as a broad, you know, base use within the facility for disinfection of rooms and surfaces.
Okay. I want to clarify, we don't currently have the system. We are still working on purchasing the system, right?
Yes, we are.
Yep, we are, which I will share a little bit more information on a little bit later. Okay, so, you know, I think we've hit a lot of the main points here, a lot of the questions I have. I would love to turn it over to anybody who's viewing. If there's any questions out there that anybody may have for Dr. Fox, for Maria Leary, regarding the UVC disinfection system, or influenza, COVID, anything you guys might be wondering about, now is a great opportunity to ask. I just kind of want to summarize what we heard here, though, because I think this equipment is pretty neat, pretty important, and is going to do a lot of things for us. So, you know, we already have a very, very stringent cleaning policy here. Our quality ratings are very high. Can you talk about that at all a little bit, Maria, our quality ratings?
Sure. We are a 5-star facility, and the things that they look at are looking at things that patients report about how we're doing and the quality of care they receive, and then also some other metrics like our infection rates, which are low and stuff, which is, again, a testament to the care that is provided by our staff and our environmental services staff and stuff. But again, anytime we have an opportunity to improve the service that we can provide to the community and improve what we're doing, and as far as limiting or, you know, preventing infections, we want to be doing that. So we just feel this is an adjunct that we can add to the services that we have here for cleaning, disinfection, or and in particular, I guess it's disinfection here, but again, and then infection prevention.
Wonderful. I have a question, so I'd love to ask that. How can you be sure that this system is working? Are we able to test the surfaces to make sure that it continues to work over time?
There's the potential to test surfaces. There's ways to test surfaces right now for organisms and cleaning that we do that could be done. There's other things that would be done looking at making sure the wavelengths are meeting and the meter, you know, the dose meter is meeting the required specifications and things like that that we can look at.
Okay. Thank you. One other question came in, and I'll actually handle this one, guys. So when are we getting the system? Well, that's a great question, and that kind of leads me into what I said I was going to talk about a little bit. So the Upland Hills Health Foundation is actually helping Upland Hills Health purchase and secure this piece of equipment. So we are turning to our community members, our business partners, and asking them to help us support this piece of equipment and bringing it to UHH through a donation. So we'd love to have the community support so that we can do that. We'd love to get the system here as soon as possible. The total cost of the system is about $107,000, and we have started our fundraising efforts already and have received a generous donation from Vortex Optics in Barneveld. So we're very appreciative of that partnership, and we would love to see the community get behind us and support the hospital, support our staff members, support our patients, and making sure that we are providing the safest, best environment possible to keep people safe. So if you guys are interested in supporting the piece of equipment, feel free to give me a call. My office line is 930-7169, or we do have additional information on our website. So feel free to jump on there and see what it's all about. The website is uplandhillshealth.org. And if you go to the About Us page and click on Foundation, you'll see some more information about the UVC Light. So thank you guys both for joining us. I'm not seeing any more questions coming in at this time, but we appreciate you logging on and giving us some more information about the UVC system and the influenza season. So thanks for joining us, and we will talk to you again later. Again, if you guys are joining us after this webinar has aired and you have additional questions, feel free to send those to info@uplandhillshealth.org, and we will be sure to pass those on to Maria and Dr. Fox so we can get you an answer. Thanks, everybody.